So today we have Dr. Loreen Rugle, and she is going to be presenting on reducing the harms of gambling for individuals, families, and communities. And Dr. Rugle, I will let you take it away.
Great. Thanks so much, Colleen. It's so good to be talking with New York folks. It's kind of like my second online home. There's so many people that I've interacted with over the years. And for those who I've interacted with, you know that this is one of my favorite topics, harm reduction, and a really, really important one from a public health perspective to an individual treatment perspective. So let's get to it. Um, Thinking of harm reduction
Speaker.
as an public health alternative to our previous kinds of moral models of addiction, criminal models, disease models, really looking at the broader impact to all of us in terms of our public health. And we don't often look at gambling in that holistic context, that population level prevention. What is the impact of this activity that so many people enjoy without necessarily much harm? What's the impact on us as a community? And then looking at some at risk groups, those groups that are at higher risk for having problems related to gambling behaviors. Well, how do we look at that and what do we do about that? And then the traditional clinical treatment and prevention perspectives, and very quickly in an hour going through that whole continuum. We do this in other areas, you know, harm reduction around drinking alcohol are all the signs about not drinking and driving. You know, bartenders taking keys if somebody's too intoxicated to drive home and calling a cab, warnings that women who may be pregnant shouldn't be drinking, around designated drivers, around cigarette smoking, where we've made such progress in terms of harm reduction at a public health as well as an individual level. So, how do we apply this same kind of perspective to gambling? Um, and you'll notice there's a big X across one word here. And, these are slides, some of which I've used for a number of years. And as I was reviewing that word accepts just hit me the wrong way. Harm reduction recognizes abstinence as one of many treatment goals. And, and then they kind of accept that maybe we can look at some alternatives. No, we have to embrace those alternatives as equally legitimate treatment options, not as stepchildren to abstinence based approaches. And we still have this attitude in our clinics, in our private practices, in our treatment settings, in our criminal, across the board. We are an abstinence based culture in many ways when it comes to addiction. Now we're making inroads and coming to understand that there may be other goals that can be helpful for some individuals, and that see the reality that these are high relapsing disorders, whether it's gambling or substance use, or sexual addictions or gaming, video gaming behaviors. People don't stop once and for all on their first go around. Um, and, this is part of human nature. We relapse on all our good intentions, whether it's to engage in an exercise program, to eat healthier, to go for a walk every day. We're not the most consistent critters on the planet. Um, and the illogic of requiring full blown abstinence as a requirement for continuing treatment or for initiating treatment. You have to want to give this up entirely before I'll even talk to you. when you really think about it, that doesn't make a great deal of sense. And we've got research now that demonstrates the efficacy of moderation goals as well as abstinence goals. This lovely study had people pick pre-treatment whether they wanted to completely abstain from all forms of gambling, abstain from only certain forms of gambling and practice moderation on others, or practice moderation in all forms of gambling, and found that not only could people pretty well pick which made the most sense for them based on gambling severity, but the moderation goals led to the same level of money expenditure as the abstinence goals. So equally as effective, and they were fluid. Some people picked one goal and stuck with it through the course of treatment, but there was a lot of movement when people were given permission to do that, and found that initially the majority of people picked abstinence. And that's consistent with the fact that surveys have shown that most people in the United States see abstinence as the only goal in dealing with addictive disorders. So let's talk some about what are the harms. And most studies have focused on what are the harms of gambling, by focusing on those populations that are seeking help or meet criteria for having the worst forms of problematic gambling. So a lot of what we've done around harm has been looking at those who have the most severe problems. And they involve medical problems, emotional problems, relationship, family members' health and well-being deteriorates, lost productivity in the workplace, unemployment, bankruptcy, foreclosure, homelessness, crime and suicide, just to name a few. And what's also important as we talk about a public health perspective is to realize that the populations who are at higher risk for gambling are also at higher risk for a whole continuum of other problems, not just substance abuse and mental health problems, but they're the same groups who are at higher risk to be seriously ill, to contract, and to die from COVID. So the same vulnerable groups are at highest risk for multiple public health problems, and we really need to see how these all coincide. Impact on family members and concerned others, the same types of problems, financial problems certainly, but family members may experience more substance use, depression, anger, conflict, hopelessness, anxiety. Women particularly are also isolated from their social networks because of shame. They may have borrowed money from family members, so they distance themselves from family. Their friends are sick of hearing about it. Men fear job loss because they see the impact of the gambling in the family interfering with their functioning on the job for any number of reasons. Obsessive compulsive ruminative symptoms, trying to problem solve, sleep, headache, sick days, and other medical problems. So very comprehensive. And what's important, this one study was really creative and looking at, well, how are we really defining the harms of gambling? Now, most of what we look at in studies and in our work is this narrow band of crisis. What brings somebody into treatment? I'm going to lose my home. I'm going to be homeless. I'm getting kicked out. They caught me embezzling at work. The presenting problem that initiated help seeking, that created the crisis. But there are a lot of other domains. There are general harms. There are all the little harms, the micro harms that have been happening across the gambling before the crisis even hit. Oh, I gambled my lunch money when I was a kid, and I gambled the money to buy my books for school, but I didn't really tell anybody and just kind of cut back a little. So all sorts of micro harms may have been happening for quite some time. And there are those individuals for whom harms are happening, and we'll look at that in a little bit, that never reach the crisis proportion. They just, oh, I couldn't pay my rent one month. I couldn't make my car payment, but then I make it up the next month. But those are harms that can be significant over the long haul. And legacy harms. Oh, I was in crisis. I decided to cut back on my gambling and to not, spend so much money, and we developed a money protection plan. But I still have $100,000 of debt, and I'm going to be paying that off for the rest of my life, whether I gamble or not. That's legacy. And I'm not going to be able to keep my kids in their private school. So my kids are going to suffer, and that's legacy harms, whether the gambling continues or not, across all these domains that we've been talking about. And then on top of that, there's life course and intergenerational harm, intergenerational trauma from gambling. We now know that there are high rates of intimate partner violence and child abuse in homes where there's a gambling problem. The inherited harms that those children witnessing that violence carry with them throughout their adult lives and even into their children's life, intergenerational trauma related to gambling. The fact that I gambled away my child's college funds so they couldn't go to college. And so they're earning less their whole lifetime because they never went to college, and their children are suffering because there were income problems in that family. So you see how this can be multi-generational, and we haven't even nearly approached having those important conversations on the impact and the trauma across lifespans when it comes to gambling. Another piece that I've alluded to is this prevention paradox. A large number of people exposed to a low risk is likely to produce more cases than a small number of people exposed to a high risk. As I mentioned, what we are looking at primarily when we talk about gambling harms in the research we've done, in the surveys we've conducted, are the harms experienced by that small number, that 1 to 2% who meet criteria for having a gambling disorder, and defining gambling harms and the impact of gambling based on that 1% with the most severe problem. We haven't really, to a large extent, looked at those general harms that I talked about, those harms that are experienced by a lot of people who don't meet criteria but are experiencing harms. And this is what that looks like. This lovely study looked at all the possible harms they could think of that are related to gambling behaviors. And they asked a whole range of people who were recreational gamblers, who never had any particular criteria for a gambling disorder or risk for a gambling disorder, to those people who would meet diagnostic criteria for a gambling disorder. So that full continuum of no problems to severe problems. And they had them indicate whether any of these harms had ever happened to them. Here's what's interesting. The light gray area are those people who are recreational gamblers. And as you can see here, when you look at the area, the domain of financial harms, almost 50% of the harms experienced in this general population were experienced by people who had no indication of a gambling problem, defined as recreational gamblers. We never thought that those people experienced any harms from gambling. But that's an impact on public health, that people who are gambling recreationally, defined as not having any problems, are experiencing harms from gambling. And we have to get better at looking at that. And even health-related harms are experienced nearly 50% of the time by recreational and low-risk gamblers, those who may only be experiencing one little indicator. And we're not doing anything to prevent further harms in these populations. The model has largely been this consumer self-responsibility model, gambling purely as a service product, a consumer good offered by the marketplace and selected by consumers who are able to maximize the good that this product does in their lives. Think about the folks, if you're a clinician, that you've seen who have a gambling problem. They're not making logical market-based decisions about how good is this in my life. This assumes consumers are informed, rational agents with access to all the options and information they need to make healthy decisions in their life. Emphasizes freedom and responsibility of the individual and puts that responsibility on the individual. Even if we give the individual more information, it's their responsibility to make those choices. And it largely doesn't look at what responsibility the deliverer of this product, the gambling industry, has to make a safe product. And many responsible gambling initiatives fall into this category. The Reno model that this is based on has some assumptions. Safe levels of gambling participation are possible. Those recreational gamblers aren't experiencing any harms, right? Gambling provides a level of recreational, social, and economic benefits to individuals and communities. Well, we know that, and it's been pretty easy to measure that. That's the easier thing to measure than gambling harm. So we know a whole lot more about how many taxes, how many people are employed. That's easy data to gather. Provide evidence-based, responsible gambling interventions to inform players. That's assuming we're putting the money into getting the evidence about which of these interventions work. And that just informing players is the most effective intervention to get them to behave in a less harmful way. Here's the kicker. Total social benefits must exceed total social costs. Given, as I suggested, we're much better at looking at what are the benefits to society, especially the financial benefits, and not very good at gathering data on the social costs. How do we make this comparison when we've got way better data on one side of that equation than the other? Okay, so we need to engage in better health promotion, building healthy public policy, not based on narrow assumptions about individual responsibility and capacity for making those informed decisions. We need to create healthy, supportive environments in our communities that give people multiple options so that gambling doesn't seem like the best option for getting out of poverty or making a decent living or dealing with emotional trauma, and strengthening community action and capacity building, developing personal skills for individuals as well as community skills for communities, and reorienting our health services around prevention of illness and prevention of harms at that community level. With diverse approaches, multidimensional approaches involving legislative, fiscal, taxation, and organizational change, and coordinated health and social policies. The healthier choice as the default option, not the most economically profitable choice, but the healthier choice as our first option at a policy level. Look at smoking policies, for example. Health can't be separated from other societal goals. and strong relationship between health and environment. For example, food deserts, the environment of a food desert, or the environment of housing with lead poisoning or lead in the water. Those are all critical issues that aren't separate from the impact of gambling and gambling related harms. Work and leisure should support health. So gambling, if we even view gambling as part of leisure, how does that support individual and community-based health? One term that's been used is to develop ethical gambling, that it's not just the individual who gambles responsibility, but the responsibility of companies and governments to create environments conducive to minimizing the harm from gambling, a moral obligation to take actions to prevent harm if you're making a living, if you're making a profit, or if you believe your taxes are being reduced by allowing expanded gambling in your community. We all have that moral obligation to consider the harms and how to prevent them. Ethical gambling develops environmental conditions that allow gambling as an economic activity with the emphasis on harm prevention. Preventing harm comes first. Economic profit comes second. And I know I've been accused of living in a fantasy world when I say these things, but consider that as a possibility. When I first started in this field, we couldn't talk about self-exclusion, voluntary self-exclusion, or putting game sense advisors within the casino domain to be resource people to help individuals reduce harm. Those were fantasies when I came into the field. So I believe in talking about what the ideal can be and how we can work towards it. So all of these areas have to intersect in developing that public health approach to gambling, focusing on the health of everybody, including those low risk and recreational gamblers, address the determinants of health, like adequate food for a healthy diet, the capacity to have healthy exercise, which means I have to have safety so that I can leave my home and go for a walk or go for a run or go play basketball. Based decisions on scientific evidence, imagine that. Upstream investments at the core causes, poorer education, lack of economic resources, mass incarceration, that all can contribute to higher rates of problematic gambling. Those issues have to be addressed to create environments where gambling doesn't cause harm because it's my only hope. Multiple interventions and strategies, collaboration across agencies, criminal justice, treatment agencies, school systems, health systems, all need to collaborate. And just a lovely diagram that lists how all of these factors contribute to gambling harms. We know that ethnic minority groups have higher rates quite frequently. Lower socioeconomic status, lower employment, lower income, lower education contribute to those who are at higher risk for gambling. Homelessness certainly contributes to problematic gambling. Problematic gambling increases health risk factors and poor health outcomes, and those who have gambling problems show lower levels of healthy behaviors, are more likely to engage in sedentary activities, have poor diets, smoke more, drink more caffeine, sleep more poorly, all of those things. So it's all interconnected, and we have to get out of our silos to have these conversations. So looking at high-risk groups, those with substance use disorder, those who are in treatment for mental health disorders, those who have medical problems, lower income folks, how are we beginning and continuing the conversation of what's the impact of gambling on your health and well-being, on your recovery, screening for gambling in those populations that we only are beginning to do a little bit in most settings. How do we talk about it in our treatment programs, in our mental health and substance use disorder treatment programs? How do we address the issue in domestic violence, legal proceedings, and within our criminal justice system? Not to say you can't gamble, you have to stop gambling, but how can we look at what impact gambling is having and whether that's being helpful to you meeting your goals and having a satisfying life, or whether it's detracting from that and increasing your risk for these other problematic behaviors. Lots of work. We know how to do this. We've done the pilots. We have the protocols. We just need to get them implemented in more and more settings. Harm reduction isn't about harm. I mean, blah. I just looked at the clock to see if I was going on too long, so I got distracted and caused myself some harm. Harm reduction is against harm. We want to stop the harm. It's not anti-gambling. It's in favor of any positive change as defined by the client. Any incremental change that's taking the consumer, the client, in the direction of better health and well-being by their definition. The client sets their own rate of change and their own goals for change, and it's not only the best pace, it's the only pace. We work at our own pace no matter how much we talk a good story in our counselors' offices. I like to say that we're all slow learners. Change doesn't happen quickly. It takes a long time to go from an inkling of a thought to an idea to a plan to I got it in my head to how do I embody that change and make it a part of my being. And can you, as a preventionist or a clinician or an advocate, take a not knowing stance? I don't know what's going to work for you. You are the expert on yourself. We can collaborate in this experiment to see what we can do together to make your life better and safer and healthier and having more meaning. Harm reduction encompasses both abstinence and gambling in moderation. Even if my goal in treatment, and we're now looking at traditional treatment interventions, if I come in and say, look, I want to stop. It's really bad. I can't do this anymore. I want to stop. Great. We still need to look at how do we reduce the harm even if you're not gambling? Or how do we reduce the potential harm even if your goal is abstinence and you slip up and you have a lapse or a reoccurrence of gambling? So harm reduction applies across that continuum of abstinence and gambling moderation goals. And it's not for use for any one age group or gender. And we started out, well, maybe this is better for women. Maybe this is better for older adults or for younger adults. No, it can be for anyone who wants to reduce the painful impact of gambling in their life. And it's not to suggest even when all else fails. And it certainly isn't to be used as a bait and switch. Oh, you want to keep on gambling? Okay, we'll do this harm reduction thing, just waiting for me to pounce when you're ready to stop gambling, and I can prove how harm reduction really isn't going to work with you, but I'll kind of let you play around with it until you see the light. No, we have to work with moderation in gambling and harm reduction with all our heart and soul, the same way we would work with a client if they wanted to stop gambling. So we need to see what our journey is to come to believe that this is a viable goal that I am sincerely going to work with this particular client. Harm reduction promotes low threshold access. You don't have to hit your lowest bottom to access services. You know, maybe if we say we can help you moderate or control or limit the harm of your gambling, you're willing to come in before it gets awful, before you're suicidal, before you've spent every last penny, versus that traditional abstinence-based high threshold approach. A bottom-up rather than a top-down approach based on client advocacy. Mostly, you know, that came from the HIV and AIDS field and substance use. Folks who were having to deal with substance addictions said we need needle exchange programs, and convinced those in policy-making positions that that was a way to reduce healthcare costs and negative harms of substance use. Harm reduction is based on the tenets of compassionate pragmatism. Let's look at what works, what reduces all our costs, what reduces death rates, what reduces financial consequences, rather than a moralistic idealism of this is wrong, so it's immoral to engage in this behavior, and you must stop it, thou must. You know, whether it's practical or not. And engage is often used for a strategy entering into a supportive relationship that's non-judging, that gives options, that menu of options to people for them to make a choice, and helps expand the range of options that they see as viable for meeting their really important needs, the needs that gambling has been meeting financially and or emotionally. And I accept my clients' choices. You know, it's not like they make a choice and it's, oh, wrong choice, no, let's not do that. No, we start where the client is ready to start and help the client in the process, and help me gain awareness of what is and what isn't going to work for this client, and ongoingly problem solve how to make things work more easily, more better, more effectively. And I do provide education around any potential harms or risks the client may not have seen or appreciated. So it's my job to present the whole picture in terms of both options that are available, as well as, gee, you didn't think about the impact that that might have on your kids, or on your family, or on your job, or where that behavior might take you. In a non-judgmental way. This is just more information. Now, there certainly may be certain situations where abstinence may seem like a more appropriate approach. When the gambling has reached extremes of severity, and this is supported by the research. Those with more severe forms and more severe problems in terms of their gambling do seem to do better with an abstinence-based approach, and have more difficulty reaching goals with a harm reduction, gambling moderation approach. So severity is an important variable. When the client has made unsuccessful attempts to moderate, it may be time to really consider, you know, a break in all forms of gambling, or let's look at the option of abstinence as a goal. I actually had a person in training, a clinician, say, well, what if the client comes in and says they want to abstain? Is that okay to work on? Well, of course it is. I know I'm an advocate for also considering moderation and harm reduction, but that doesn't mean you have to work and get the person to moderate their gambling. No, clearly that's a viable goal when that's what the client wants to do. Or when the client needs a level of care that requires an abstinence-based treatment program. Most residential programs are abstinence-based. When the client is mandated by an employer or they've already committed illegal acts, you may want to suggest that they think about abstinence in order to keep their job or to avoid further criminal offenses, or being compassionately pragmatic. What I tell people that I often see for forensic evaluations, you know, it's just not going to look really good to the court and to the judge, you know, if you keep on gambling when you've already created such harm. It's going to look much better if you can honestly say, I have not gambled since I got caught. I've seen the light. So very pragmatically, even though that's hard for those individuals to do often. When relationships and families are at risk, if the partner is too anxious at the thought of a limited or moderated gambling goal, if they say, I can't live with that, then maybe you want to consider abstinence. But I have had couples where the person with a gambling disorder, given that choice, I'm going to leave you if you don't stop gambling. What do you care for more, me or your gambling? They've chosen their gambling. That concretely, that specifically. So it's always a discussion. And again, the research suggests that individuals understand that my gambling problem is so severe, I really need an abstinence-based goal because I don't think there's any way I can control this. Disadvantages: abstinence doesn't recognize improvements or successful attempts to cut down. So it's an all or nothing kind of approach, you know, and it doesn't help people understand the positive things they may have been doing in terms of not gambling quite so much, not spending quite so much money, having some periods of several days or a few weeks where they didn't gamble at all. So that doesn't let people acknowledge that they're moving in the right direction. Abstinence criteria may be excessively stringent and therefore a barrier for potential clients entering a treatment program. If that's a requirement, they might not be ready, it doesn't match their goals, or they think it's too difficult to achieve. Now, I could cut back, but I don't know I can completely abstain. And it's in contradiction to some of the current research that suggests moderation is a legitimate and achievable goal for some of our clients. Some basic issues when we start working on harm reduction is, well, finances. That's always a pretty obvious harm that folks with a gambling problem may come in with. So how do we protect money or limit access to money and credit to reduce the potential harm of any ongoing gambling or excessive gambling? And boy, it is so critical to involve the family in this process and in this decision making about what's the goal going to be. As a family, what goal can we support? Can we understand how we need to look at reducing the harms, even if the person's goal is to not gamble? Or if the goal is moderation, how that can include reducing harm for the family as a whole, and how we can monitor that and make ongoing decisions around that. FRAMES isn't an acronym, so what we do is we give feedback to the client. The client assumes responsibility for their behavior because they're making the choice, they're setting the goals. It's not up to us. Our role is that feedback and creating a non-judgment safe space where we can talk freely and honestly about all the issues. We can provide advice about what might work better or what other clients have done in similar situations, that range of options that might be available the client hadn't considered. Understand the world from the client's perspective, that empathy and compassion. Empathy, yeah, I can understand your pain and tap into a place in myself that can feel that kind of pain. And with compassion, the wish that we put an end to that pain, not just stay stuck in it and stuck in that pit of hopelessness or depression or anxiety. And because you've taken responsibility, then you can build your sense of self-efficacy because you're the one doing this. You're the one making these difficult choices and engaging in behavior change. So let's look at Nick as an example. A 36-year-old male, he's in his first marriage, he's been married 6 years, he's got 2 kids, ages 2 and 4. He's gambled since age 14, primarily on sports. His income is $100,000 a year. His debt is $55,000. They're getting behind on bills. There's increased marital conflict. His drinking is increasing. He loves gambling. And in no way does he want to commit to total abstinence. But he's willing to try to cut it back and reduce the harm. So one of the first things we might do is just see where we're at, to gather more information, to find out what is the extent of gambling, to get a clear picture. So just a self-monitoring assessment. Each day, what did you do? Who did you do it with? What was the situation? How much time did you spend? Did you win or lose? And what were the other consequences? Because most of our clients have a lot of gaps in their self-awareness, as do we all. And when we start looking at it and noticing it and writing it down, we see things that we hadn't noticed before. So he documents and brings this back to us, And the first thing we do when he brings in this completed assignment is we affirm, wow, you did a really great job. Looks like you were being really honest. You recorded your losses, you recorded your feelings. You really did a very thorough job. What do you make of this? Not, here, I'll tell you what this looks like. You get the client's input. What did you notice as you were doing this? And maybe he says, well, that sports bar seems to be like a problematic location. It's really hard for me not to gamble and get a bit out of control. No matter how confident and lucky I feel, going there just doesn't seem to be very helpful. And then I feel anxious and pressured, and it increases my stress. Anything else you notice? Well, the only day I felt good was the day I didn't gamble. Yeah. Then another validation. Wow, those are really good observations. What do you think you want to do with that in terms of setting goals for next week? Yeah, so you see how this is using that frames model, just helping clients see honestly and accurately the consequences of their own behavior so they can come to their own conclusions. And we could help problem solve. Is there any place else you could go for lunch other than that sports bar? Is there a McDonald's someplace? Or is there a bar where there isn't any sports betting, or your gambling buddies, or your bookie, or whoever? And understanding and broadening that range of alternative options. And constantly re-clarifying the client's goals. So how do you want to set your goals in terms of your harm reduction and gambling in moderation? any limits you want to set around that. And we evaluate the client's adherence to the plan as a measure of motivation. So if they set goals and they keep those goals, then that suggests a high level of motivation and that we're on the right track, that the goals match what the client is motivated to do. If they're not adhering to the plan, that suggests that maybe the goals are not the right goals, or they don't have the skills to meet those goals, or that's really not what they're motivated to do, and we have to revisit those things and, take a deeper look at, well, what are you really motivated to do? Because there seems to be some ambivalence going on here, and what are the next steps? So we give the client feedback, correct any summaries or any of our observations, and keep developing this atmosphere of harm reduction, an atmosphere conducive to change. And we help the family learn how to create that environment within the home, how to be non-judgmental, how to reward change, how to be curious about any behavior, whether in the desired direction or not, to allow for increased honesty. And, how can the family feel safe? What can we put in place if we're going to do moderate gambling to allow maximum safety and minimum anxiety for the family? How can we have transparency discussions, asset protection planning, and put it all in writing what the plan is so everybody knows real clearly and it doesn't get confused in our heads over the course of a day or a month or a week. Identifying the warning signs. How will I know if this plan isn't working? How will I evaluate whether it's working or not? And what will I do if any of these warning signs pop up or my loved one notices any of the warning signs? How will we talk about it? Will we talk with a counselor? Will we strengthen our money protection plan? Will I take a break from the gambling because some warning signs are creeping in, so just a timeout to reevaluate, or anything else? Whew. I don't promote drug use. I don't promote car accidents either, but I still think seatbelts are a good idea. Harm reduction. Practicing common sense since the 1980s. Thank you so much for your kind attention and listening. Any questions? Oh, there's lots of stuff in the chat I didn't notice.
Dr. Rugle, I did note just a few of the questions. So two of them are similar, kind of suggestions for handling a group in which one client is following harm reduction, but they're in a group where folks are abstinence oriented. And this other question that's similar is, how would you manage issues that occur when we have therapy groups with clients who have widely different goals?
Yeah. Think about any group of substance use clients has that range of gambling behaviors in it, from people who don't gamble at all to people who have significant problems, and any place in between. So when we start talking about it, what we do is talk about what's the impact of gambling on my recovery, and that's different for every person in that group. So if you start out with the premise that everybody's at a different place and needs to decide upon their own goal, and it's our job to help each other do that by joint problem solving, and just because I decide it's a real problem for me and I can't gamble as part of my recovery doesn't mean that this person over here can't occasionally go to the casino and never develop a problem. But let's look at the potential risks and what works for each individual. When people are coming into a program specifically because their primary concern is their gambling, it can be very difficult to have harm reduction and abstinence in the same group. Again, if you start out with that expectation that everybody's going to be working on their own gambling goals, it's a lot easier from the get-go, and that we don't judge, even if we may problem solve if somebody's struggling to meet their goals. You know, we don't judge what their goal is. So it really has to be set up from the get-go that all these goals are viable options. And it's challenging. It's a lot easier, as I've done in some settings, of having a harm reduction group and a limited gambling group and having an abstinence group. But it can be hard to have enough numbers to have those two different groups. Have a co-therapist. You know, that's one of the best things you can do at first, is have a co-therapist and really make it a group decision. Do we want the group to include this full range of options? If you can get the group to buy in, that goes a long way. Make it a group decision-making process. Hope that helps.
Thank you. Some of the other questions were, do you know of any state or local jurisdictions who have already or moving towards incorporating harm reduction options into mandated treatments?
Mandated treatments for what? For gambling or for substance use?
It didn't specify.
I don't know of any jurisdictions that are making that, you know, kind of an across-the-board mandate. There are jurisdictions that have put effort into integrating gambling into mental health and substance use programs. And by definition, you have to work on harm reduction if you're dealing with gambling as the co-occurring disorder when the primary disorder is something else. You don't have to, but you know, you can't mandate that everybody stop gambling if their primary concern is something else. But hopefully we can educate more and more jurisdictions on the utility of this, because if you don't address gambling and don't give people options, you're losing people, you're not addressing where people are at, and you're likely going to increase healthcare costs by making it a more severe disorder by the time it gets attended to.